female construction worker whose tape measure came in contact with the high voltage electrical wire. The patient is conscious and breathing. Okay, so I have my PPE on, I have my latex gloves, my safety goggles, my helmet, and a mask and extrication gloves in the EMS bag. Okay, is the scene safe?
Yes.
What is the mechanism of injury?
Electric shock. The patient was measuring a beam when the wind blew his tape measure into a power line.
Okay, how many patients are there?
1.
Okay, so based on the MOI of the scene, I have to call for ALS, and along with that, I need to call for additional resources, such as a fire team and a power company. And if anything, I'll get a medical helicopter as well. Okay, so for this scenario, I would have to apply a C-spine inline immobilization in the patient. So like this. So as I'm keeping the patient's head in line, I have to make sure that they don't move.
Noted.
No, I know that their general impression is that they're unstable.
Noted.
What is their level of responsiveness?
Alert and anxious.
What is their chief complaint?
The patient is complaining of feeling burned and a pins and needles sensation all over his body.
Okay, so I would say that they're having some life threats with their MOI, and they have eternal burns.
Noted.
Is their airway open? Are they breathing?
Yes, the airway is open and the patient is breathing.
Okay, what is the rate and quality of breathing?
Rate. Tachypneic. Quality. Deep.
I will now be applying oxygen via non-rebreathing max to the patient.
Noted.
Okay, I see that the patient has adequate ventilations at this time.
Noted.
While I will assess the whole body of the patient, my partner will be keeping the head in line and position. So go ahead, partner. Okay, good. So I will now be applying the circulation.
Noted.
So I'm checking the body. Is there any major bleeding?
No.
What is the rate and quality of pulses?
Tachycardic. Quality. Bounding.
Okay. I am assessing the skin. What is the condition, color, and temperature?
Color. Pale. Temperature. Warm. Condition. Diaprotic.
Okay. I can tell that the patient is a high priority, and I will load and go and take the patient and transport them.
Noted.
I'm selecting the rapid physical exam and identify life threats, and I will be doing DCAP BTLS, which is an acronym that stands for deformities, contusions, abrasions, punctures or penetrations, burns, tenderness, lacerations, and swelling.
Noted.
Okay, so I will be rapidly assessing the head.
There are no obvious injuries.
Okay, I'm assessing the neck.
There are no obvious injuries.
Okay, and I will apply a cervical collar to that area.
Noted.
Okay, I am assessing the chest.
There are no obvious injuries.
Is there any lung sounds?
They are clear bilaterally.
Okay, so I am assessing the abdomen.
There are no obvious injuries.
I am assessing the pelvis area.
There are no obvious injuries.
And I'm going to assess the extremities as well.
The patient has an entrance wound to the right hand and exit wounds to both feet.
Okay, so In that case, I'm checking for decap BTLS, motor sensory function, and pulses to the right leg.
An impulsive electrical burn injuries is found to the toes. Left motor sensory functions are present. Pulses are present.
Okay. The left leg?
An explosive electrical burn is found to the heel of the foot. Pulses are present.
Okay. Right arm?
An explosive electrical burn injury is found to the palm and the fingers of the hand. Motor and sensory functions are present.
Okay, and left arm?
Negative decap bliss. Motor and sensory functions are present. Pulses are present.
So I will now be assessing the back side of the patient. So we will roll the patient over. My partner is gonna count us down as we roll the patient.
1, 2, 3.
Okay. I'm assessing the thorax. Do I find any injuries?
No.
I'm assessing the flanks and lumbar area. Do I find any injuries?
No.
Okay. I'm assessing the backside. Are there any injuries?
No.
Once I already applied the cervical collar to the patient, I will be applying sterile dressing to the injuries. Are there any changes in motor and sensory functions or pulses?
No.
I will establish a 2 large bore IVs en route to the hospital and administer a bolus of 20 milliliters per kilogram in order to have a blood pressure of 90 mmHg. I'll monitor the heart and perform a C12 leg to the en route.
Noted.
Due to this, I will do a load and go situation due to the MOI.
Noted.
Okay, what are the patient's vital signs, including their blood pressure, pulse, respirations, pulse oximetry, and level of consciousness?
Blood pressure 150/90 mm Hg. Pulse rate 150 beats. Respirations 24 breaths per minute. Pulse oximetry reading 98%, and the patient is alert.
Okay, at this time, I will gather a sample history from either the patient or their family members. What are their signs and symptoms?
Pain and a feeling of being burned all over the body.
Do they have any allergies?
No allergies.
Do they have any medications?
No medications.
Their past history.
No permanent past history.
Their last oral intake
3 hours ago.
and events leading to their injury.
The patient was measuring an I-beam when the wind caught his tape measure and blew it into a power line.
I am conducting the detailed physical exam and I'm doing decap BTLS.
Noted. The detailed physical exam will be performed during transport.
Okay, so I'm assessing the head. Do I find any decap BTLS? Do I find any evidence of Bartley or raccoon eyes?
No.
Okay. I'm assessing the head/ears. I see that her pupils are equal, that they don't have any raccoon eyes.
They are pro.
Okay. Okay, I'm assessing the face and nose. Do I see any obstruction?
No.
I'm assessing the neck for decap BTLS. Do I find any jugular vein distension?
There are no obvious injuries.
Okay. Do I see any tracheal deviation?
No.
I'm assessing the chest for decap BTLS.
Noted.
What do I do when I look at the chest? Does the chest appear to be symmetrical?
Yes.
When I touch the chest, do I feel crepitus or flawed segment?
No.
Are lung sounds prolactin at this time?
Yes.
Are there any sucking sounds in the chest?
No.
Okay, I'm gonna assess the abdomen. Do I find any problems?
No.
Assessing the pelvis area, does it seem to be stable?
Yes.
Okay, I'm assessing the genitalia, or do I find anything?
The area is unremarkable.
Okay, now I'm gonna check the lower and upper extremities for decap BTLS and motor and sensory functions as well. Starting with their right leg. We'll I will put a sterile dressing on the patient's toe where he got injured.
Noted.
So I'm gonna wrap this around their foot and put a little piece of tape right here to keep it from. There you go. What about their left leg?
There is an explosive exit wound to the heel of the foot, and the motor and sensory functions are absent. Pulses are present. Bleeding is minimal.
Okay, since it's the same thing as the other leg, I'm just gonna do the same thing, but like on the heel of their foot. So like right here, and I'm gonna apply a little bit of tape. Okay, there you go. And then what about their right arm?
There is an entrance wound to the hand. It is smoking and bone appears cooked. Motor and sensory functions are absent. Pulses are present. Bleeding is minimal.
Okay, so since it's gonna be on the palm of the hand, I'll put it like around right here, wrapping it around. Okay. Good. And then their left arm?
Negative decap blitz. Motor and sensory functions are absent. Pulses are present.
I will not be assessing the back because we already assessed it already. Meanwhile, my partner is gonna monitor the patient.
Noted.
And I'm going to assess vital signs. Oh.
Blood pressure 146/90 mm. Hg. Pulse rate 144 beats per minute. Respirations 20 breaths per minute. Pulse oximetry reading 98%. And the patient is alert.
I'm now checking the pulse. Okay. The vital signs have not changed.
Noted.
I will reassess my interventions, oxygen sources, dressing, plus assessment and reinsurance. I will confirm medical transportation. I will reassess basic life support, plus BLS interventions, plus the following: 2 large bone IVs, cardiac monitor, 12 lead ECG, advanced cardiac life support, ALS, and regional protocol for possible pain management.
Noted. The cardiac monitor shows sinus tachycardia.
And I will reassess the vital signs again.
Blood pressure 140/82 mm. Hg. Pulse rate 130 beats per minute. Respirations 20 breaths per minute. Pulse oximetry reading 98%. And the patient is alert.
There was no change in the transport decision making.
Noted.
Hello. EMS 10 responding to a 40-year-old patient who was a construction worker. His chief complaint was that his tape measure came in contact with a high voltage electrical wire, and which led him to have severe burns on some of his extremities. As for his breathing, it was really well, along with his consciousness. As for history taking, he had signs of feeling a burning sensation all over his body. He had no allergies, no medications, no past history. His last oral intake was 3 hours ago, and events leading up to injury. The patient was measuring I-beam when the wind caught his tape measure and blew it into a power line. Now, for his level of consciousness, it seemed to be alert and anxious, which was a little bit concerning, but not as much bad as it would have been. And we took their vital signs, and this is what we got. So we have a blood pressure of 140/82 mmHg. A pulse rate of 138 beats per minute. His respirations is 20 breaths per minute. Pulse oximetry is 98%, and the whole time the patient remained alert, which was very good in our situation. And as for the interventions, he had 2 injuries on both of his legs and 1 injury on his right arm, but he had no signs of injury anywhere else besides his body, not even his other extremity, his left arm. So for his right leg, he had an injury on his toes. For his left leg, he had an explosive exit wound to the heel of the foot. And for his right arm, he had an injury on his hand. It was like palm of the hand, actually. So for me, I applied sterile dressing. To both the injuries, making sure that both of them remained clean before I applied it. And so because of the injuries on most of his extremities, I applied sterile dressing on all the injuries, and to help keep still of it, I used a little piece of tape to apply the dressing to the extremities, and to cut it off, I used trauma shears to cut the tape and apply it to the patient. After that, the patient seemed to respond well. He was still alert after, but he wasn't as scared and worried before, after I treated his wounds. So we will be at the hospital in less than 10 minutes. Do you copy? Okay, over and out.